Just like to say hello to our guests, and we will be going live in about 2 more minutes. So those of you who are streaming on, you will hear silence, but just hold on for another 2 minutes before we begin. It's 3 o'clock. Good evening, everyone. We still have a couple of people streaming in, so we'll give it a second. You're going to be in for a real treat this afternoon, so I'm glad that you guys are joining us. Just give it a second, and then I'll introduce my folks. Like and share and invite other people in today. We want to bring in a whole bunch of folks today. Hello, my name is Phyllis Everett. Thank you for joining us. My name is Phyllis Everett again. I'm from Saffron Trust Women's Foundation, an organization that looks to make a difference in the negative health outcomes in Austin, Texas. We partner with other organizations who have the same mission in mind, and we advocate for families. And today, for this platform, we are here to be another vessel to bring awareness and address concerns about how COVID-19 affects our community. Yeah, our community. We are hoping that Austin is listening and that this platform that we have here today reaches those who affect change in our community. And so we also want our community to know we're here today, and we created this platform because we hear you. We hear your concerns. We see what's going on in our community, and we're also affected, with the things that are going on in our community. And so we've created this platform to have courageous conversation and some really good dialogue. And so with that being said, I'm going to turn it over to the one and only fabulous Miss Kimberly Holiday. She's going to take it away. Thanks, Kimberly.
Thank you so much. Good afternoon, everyone, and welcome to Thankful Thursday. My name is Kimberly Holiday, and again, I thank you, Miss Phyllis, for seeing the best in me and giving me the opportunity to share this platform. By trade, I am a social psychologist, but right now during COVID, I am spreading a lot of joy and no germs. That's what I'm doing on all of my platforms. And so I'm super excited to be here today. We have a lot to talk about. This is week number 3 of Minority Table Talk. As Ms. Phyllis said, this is where we have courageous conversations about the color of COVID, right? And how it affects the residents of Central Texas. So, with that being said, today's topic is residential segregation and healthcare shortages during COVID-19. Now, I have prepared a whole lot of notes, but we're going to get real right here today because the truth is, this is a conversation that we need to have. When I thought about it after I put my makeup on, I was like, well, Kimberly, if you were to get sick or anyone in your home, the truth is your husband was furloughed and so was your insurance. So I'm excited to have this conversation today, and I'm glad that we're here today. So this is the Power Hour. I thank all of you for being here. We value your time, and so I want to jump right in. So as you can see on the screen, my job is to create sanctuary for everyone that is here. So we've already done that. So I welcome each of you in, but you do see a new face on the screen today. We have, oh, he is a firecracker. I would like to welcome to this amazing platform, Mr. Joshua Robinson. And hello, welcome, my new friend. Yeah, and I feel like we're already friends. For those of you who don't know him, he serves as the Quality of Life Commission's liaison for the City of Austin Equity Office. Now, that's a mouthful. So we are so excited to have you here. What I'm going to do for formalities, though, is I'm going to give them just a snippet of who you are, if that's okay. All right. So Joshua Robinson is a native of Kansas City, Missouri. He is a two-time graduate of University of Kansas with a Bachelor in Science in Broadcast Journalism and a Master of Public Administration. Robinson has extensive knowledge of municipal government services and has experience working with communities of color and addressing issues that affect marginalized communities. Woo! Are y'all ready for this? Joshua, we welcome you. All right?
Thank you
All
very
right.
much.
All right. And our guest of the hour, the speaker of the hour, why we are here today, Miss Mia Greer. We welcome you to this platform today. Thank you.
You're welcome.
So, Miss Mia Greer is the COO of Community Coalition for Health, which is also C2H. This is an organization whose goal is to reach underprivileged communities by building clinics that will help communities and educate communities in the fight against diabetes. Whew, y'all ain't ready for this. A recipient of a Bachelor of Science in Nursing and Health Administration from the University of Alabama. Ooh, she loves them. Mia is a registered nurse with more than 25 years of nursing experience and 10 years of clinical laboratory management, including national laboratories. All right. Mia has played a very important role in the startup of operation of laboratories in 13 states. She is a member of the Texas Healthcare Association. As a leader, Mia has been trained and mentored by some of the best and the brightest, including Dr. Charles A. Moody Jr., who is an international leadership consultant, community leader, and ministry pioneer. So, without any further delay, I would like to introduce to some and present to others our guest speaker of the hour, Miss Mia Greer. Welcome.
Thank you. Thank you. Glad to be here.
So I'm going to turn it right over to Joshua, who will be facilitating our conversation on this afternoon. Thank you.
Problem. Thank you so much, Kimberly. Well, welcome everybody. It's so great to be here today. Once again, as Kimberly mentioned, I work in the City of Austin Equity Office. And with doing work with the community, I just realized that myself and Mia, we have multiple connections with different people, but this is our first time actually connecting on a virtual level. So it's so great to connect with you, Mia, and I'm really looking forward to this conversation. So let's get right into it. So during this time around COVID-19, I think that the narrative has been that, because of, many reasons, Black and brown people are more likely not only to get COVID-19, but unfortunately die from COVID-19. So Mia, I wanted to ask you, why do you think COVID-19 has hit the Black and brown skin population so hard as it has?
Well, the first thing is because we already had the pre-existing conditions before COVID-19 that put us in a situation where anything that could have came through would start wiping us out first. I say that because we're number one in diabetes. We have high blood pressure. We have hypertension. We have hypertension. We are obese. We don't exercise. We don't eat right. We are gentrified. So we already had strikes against us before COVID-19 hit. COVID-19 just exacerbated the reasons that we are hit so hard when it comes to health and healthcare issues. So that's why our rate's so high. It's some of the fact also is bias in the way that we're treated. So for instance, I had a family member who, my daughter's family member went to the doctor and she was tested for COVID-19. She had the symptoms for COVID-19. She was sent home and she died the very next day. So I wonder if she was, if she was Caucasian, if they would have sent her home. So we have a lot of that going on here where they seem to think that we aren't as sick as everyone else, but we are sicker than most.
Right. Absolutely. And doing the work that you've been doing around COVID-19, have you seen any connections with geography and COVID-19 hotspots in Travis County?
Absolutely. So I don't know, I'll explain how Travis County is kind of set up. They kind of set us up since 1920 for this kind of situation. So in 1920 is when they made the plans for Travis County in the first place, where it was to ultimately push African Americans out of the city. So they've been working on this way before COVID. They've been working on this for a long time to push the African Americans and the Black and brown skinned people out of the city proper. So they moved us out of the city proper and they moved us to what is now called the Eastern Crescent. And the Eastern Crescent is where we have more of the Black and brown skinned people. One thing that they've done is they moved them without moving their help. So they didn't move their clinics, they didn't move their hospitals, they didn't move the transportation system, they didn't move the grocery stores. They just moved the people without moving their help. So if you look at the map that you can look up on Central Health, actually, if you look at the map, the hot spots, coincidentally, which is funny, that started in 1920 by moving us out of the city, by taking our health care from us this way. The hot spots is where you see the COVID-19 blaring. You see the hot spots in the Del Valley area. You see the hot spots in the Austin Colony area. You see the hot spots in Colony Park, Hornsby Bend, Hutto. And if you go with the plans of 1920, no matter how you look at it, it was never meant for African Americans and Latinx to thrive in anything that happened. So COVID-19 just said, you see 1920, we're really helping you with this right now. We're helping you bring to the forefront that we really had no plans for Black and brown skinned people from the beginning.
And I know that when COVID-19 started to expand more, a lot of nursing homes had outbreaks, in particular the one in Washington, I remember. So for people who have a loved one in a nursing home, what should they do in regard to that, to protecting their loved ones?
Well, the first thing about nursing homes, and I've worked with nursing homes. I was the person who would go in and do the audits. I would make sure that all of the testing was done for the patients. I would give the tags on the nursing homes to make them stay open or shut down. And the one thing that I would do if it was my mother or my father in the nursing home is make sure that you know who the nurses are. And it's very key that you know, you don't need to know the director. you need to know that CNA that's working with your mom or your dad or your cousin or your brother. Because if you bring that CNA some lunch, if you bring that CNA some coffee, you bring that CNA some flowers on Nurses Week, that CNA will tell you everything that's going on with mama, will tell you everything that's going on with grandpa. Right. She will keep an eye on her or him, and she will report to you. We tend to want to reach the highest level person to keep up with our people when we will look over the people who really care for them. Right. So I would be the best friend with that CNA on every single shift. They would see me coming, or they would pick up their phone and say, Miss Mia, let me tell you what they did today. Right. And so, and I would be a pain in their behinds during COVID. I would call every single day. I would say, I want to see what's going on. Tell me, walk your phone down to her room. Let me look at her, because the more you get on their nerves, they know that that's not the patient to mess with. That's right. And we know historically, Black folks sometimes don't trust the healthcare system. So what would you say, Ms. Mia, how can we ensure that we get the healthcare that we deserve when we're speaking to our healthcare provider? Well, one of the things that Black and brown skinned people tend to do is think that doctors are gods. They are the voice of everything. They are the end all, the be all, that we are to walk into their offices. They give us those 3 minutes and we are supposed to be happy about it. And we listen to them and we take that prescription and we go and get it filled, and that's how it's done. That's not what you do. That's right. You sit there, I shake their hands, they look at me in my eye, I say, hello, my name is Mia Greer, nice to meet you, so that you know, and he sits down or she sits down and you sit down, you come with your questions in hand, you don't let them brush you off, you don't let them rush you, and you ask the questions that need to be asked. I always say that medicine is a practice. That's why they call it practicing medicine. So you ask them, why are you giving me this pill? What is it supposed to happen? What is the side effects? Do I really need to take this? You don't have to just listen to what they say. And for your parents and your loved ones, go with them. Because a lot of times, especially the elderly, they really feel like that doctor is, what a doctor told me to take this, what a doctor said this, and they're afraid to ask because for some reason we feel like that we are not able to ask the questions about ourselves. And so when even my daughter is young, as much as I know, when I go to the doctor, my daughter, if she comes with me, she tell them that call me because she don't lie, because I will sometimes. And if you go with your parents, you go with your loved ones. I have cousins and aunts, they'll call me and ask me, what should I ask before I go? I'm going to get this done. What should I ask them? So remember that the doctor is there working for you. You ain't there giving him nothing. You're paying him. You're paying her. It is their job to make sure you are taken care of. Make sure they handle you right. That's right. Make sure they handle you right. Because I've in the years of nursing, especially Black and brown skinned people, they like to brush us off. Like, how dare you ask me a question? Who do you think you are? And I'm the first one to say, look, excuse me, I'm not done. Excuse me, I have a few more questions to ask you. Absolutely. And they have no choice but to sit back down. They really only have 3 minutes with you. That's what they decide, so they can make that money. Three minutes per patient, so they can churn them out. But they're gonna spend more than 3 minutes on me and mine. That's right.
And that's some good information. Sorry, I had to jump in there. That's like, you never even think about that. Like,
You're right. Another tidbit I want y'all to put out there that I tell people about is the emergency room. If you go to the emergency room and they give you that bracelet,
yes,
and keep that bracelet on for 24 hours. Because if you take that bracelet off, your billing starts all over again. So let's say they send you home and there's something wrong and you say, I need to go back to the emergency room. If you keep that bracelet on, you don't have to keep paying. It's still that same visit from when you put that bracelet on within 24 hours.
Wait, did anybody not know that? Because I did not know that.
I didn't know that.
Kimberly?
I didn't know that.
I didn't know that. When I go back, it's gonna be all different shades and colors. I'll be like, you know, yeah, and that's really important. We're laughing about it, but I've had to choose which emergency room to go to because some of them, without saying names, have the doors locked and you can't get out of there until you stop by their billing office to either pay some huge, crazy copay when I usually say bill me. So thank you for letting me know. Just hold on to the bracelet.
That's right. That's right.
I'm gonna go back to quiet. Thank you so much. This is good. Thank you.
This is.
And if anybody got any bracelets, they can mail them to me. Just
no, it's got to be within 24 hours now. It's got to be within 24 hours. After 24 hours, go ahead and cut it off. But don't cut it off. If I would wait 24 hours just in case some more of your symptoms or whatever they told you was the problem persists when you feel like you have to go back.
Joshua, if you would allow me just a moment, I would like to just jump in real quick and remind everyone that this is an interactive experience. A lot of you are watching right now or you'll watch later. I want you to know that we want your questions. We actually encourage your feedback and your comments. And again, I have undressed myself to let you know that if I were to get sick, I really don't know what to do. So if you have questions and you're like me, and all of us have been affected by COVID in some way, right? We encourage your questions today. Thank you so much.
Absolutely. And I think another question I have for you, Ms. Mia, is, doing your work around health and even now in particular, what concerns have you been hearing from community, during your time?
The community concerns is that, especially Black and brown skin, is that they're not really being listened to. We as a community, people tend to, or organizations tend to tell us what we need. And they're coming to help us. We know what y'all need. Let me give you this.
Yeah.
When they don't ask us what we want and what we need.
Right.
They don't pull us into the rooms that are making the decisions. They don't let us sit at the table where they're talking about us. They just come and tell us this is what you're gonna get and you don't have a fit. And my thing is, let's start having fits.
That's right. Absolutely. Absolutely.
Because that's what most people are really, really upset about is they'll make a decision, come into our community, start turning over tables and knocking down chairs and leave, and we got to clean up the mess.
Absolutely. Absolutely. And so with that said, why is it so important to have this conversation? You probably already answered this, but why is it important for Black and brown skin folks to have this conversation around health and make sure that we're informed?
I'll give you a prime example. I was in a meeting once, and one of the guys, they asked one of the community members, well, what do you want? And he said, everything. He said, no, they were like, well, if you had the first thing, what would you want? And he said, everything. And my thing is, whatever's happening on the west side, we want to happen on the east side. Everything that's going on the west side needs to go on the east side. Everything. So we even found out in a meeting earlier that the numbers are so disproportionate, it's crazy. The COVID testing in one neighborhood is like 30 times more than the COVID testing on the east side. And that is ridiculous. They are being tested 6 days a week when the east side is being tested twice a week at different locations. So you don't even know where to go on what day. And you don't know if it's going to be 2 hours or they don't see two people show up, so they'll leave with the two people. We don't know that, but we do know on another side of Travis County that they sit there all day long and they let as many come in as they want, and their numbers are high, and 6 days they don't. The only day they take off for that side of the county is Sunday. But they only give that community 2 days out of the week. So if that's not disproportionate, I don't know what is. And I just can't be quiet about it. It's just hard to be quiet about it because it is blatant.
That's
and
right.
it's strategic. They
Mhm.
mean to do this. It's
Absolutely.
not an accident.
Absolutely. Absolutely. And Miss Phyllis and Kimberly, did you all have anything to add to that, or a comments or anything?
Kimberly, you go right ahead. I see you. You got a lot.
Oh yeah, this is Zoom, guys. There's this ability to have this side conversation on the side where I can talk so I don't interrupt. But since you brought up testing, I want to know, where is the testing actually available? We're not going to start thinking about this question until someone in the house actually needs the service. Can you help us right now, since you're on the inside? Tell us, where is this testing? And my other question is, well, if it's on the west side, can I go to the west on one of the 6 days?
You sure can. It's at the Hancock Center on the west side.
I love Mia. It's at the Hancock Center on the west side.
And then on the east side, there it's going to be at the middle school. I believe it is, we wanted it at Del Valley Middle School, but it's not. It's at, I want to say, I can't remember, maybe Kit Middle School, maybe.
Okay.
But I'll get that for sure. But
and we could send that to the link on the stream. Yes, people watch it later.
But I remembered where it was on that side for sure. But yes, so that's 6 days a week. I couldn't even tell you what days of the week they do it on the east side. And then they just changed the location. So the location was a tent next to the fire station, where you could even walk up to get tested. So they just changed it last week to, I want to say Kit, but I'll verify that. But there's no verification for me. It's at the Hancock Center on the other side of town.
That is so awesome. Thank you for that. Thank you for that. And if someone wanted to find out where testing was, where would they look? Is there a particular website? Because if the location is changing, then that's also feels very strategic as well. Because if I can't find you, then I don't know where to go.
Well, the issue is that pretty much the community ran them out of where they were because the community felt like it was hurting their health. That it was opening them up to COVID the way that they were doing it there. So that's what ended up happening. That's another thing why I said they made a decision for the community without asking the community. But you can always look it up on Austin Public Health. Austin Public Health is where you can find where there's testing. Also, Community Care has a list of where their testings are being done.
And so, Ms. Mia, would you need insurance to get tested or anything like that?
Now, if you are Medicaid, if you have Medicare, Medicaid, if you're on assistance, you would not. Right now, though, what's happening is if you do not have insurance and you have the symptoms, they're going to go ahead and test you without insurance. But if you have insurance, they will take your insurance.
They'll take it. Got it. And so during your time working in the community, and I think in particularly now, what are community leaders doing to address this pandemic?
Well, it's funny you say that because I was also in a meeting where we had a discussion on who actually was community leaders. So
yeah, that's
there's sometimes that, we may have the titles and we may get paid for the role.
Right.
And that does not mean that you are the leader of that community.
That's right.
So a lot of the true boots on the ground leaders, they're out there, they're fighting, they're saying, no, you're not going to do this to us. I say all the time to my boss, I said, the one good thing about me is can't nobody fire me but you. So a lot of times when you are running for councilman or you're running for attorney, you're running for this and you're the head of that and you're over this and you're the president of this and that, you got to pick their side because you could lose your job. And so that makes them a different type of leader, because a true leader is going to speak up for their community, whether it's right or wrong, or whether it's going to get them in trouble or not. And so that's why it's easy for me. I can say what I want to say about pretty much anything, because there's nothing anybody can do to me, and nobody owns us. Community Coalition for Health, we've turned down contracts when it did not benefit us, when we had to compromise who we were. You know what? You can have that. So you have to be able to stand up for what you believe, and a lot of times you really cannot if your check depends on what somebody makes you believe. So you have to believe what your checkbook tell you to believe in some instances.
I'm so glad you're here. I just love Miss Mia. I just love Miss Mia.
Yeah.
And
I think
she's pretty fierce.
I love it.
Yeah.
I wanted to know, what would you say to those 33 million people, 1 in 5 American, who have filed for unemployment and really don't really have any insurance at this time, where we're afraid to go to the emergency rooms, not because I can't pay, just I'm afraid to go there, right?
Yeah.
But what would you say to us right now?
Well, one thing I'll say is this is a perfect time for, first of all, y'all, most of y'all know that I'm Christian. I love the Lord. He is my end all. He is my be all, and I love it.
That's right.
So first of all, I would make sure that I had a church community. Make sure that you are in a community that prays with you, that looks out for you, that loves you. You have a pastor that will direct and guide you. And that's one thing that I do. Another thing is, at this time, you can't be prideful. You got to reach out to people at this point. Sometimes, if I have a potato and you got some ham, we got some hash.
That's right.
So at this point, we got to really rely on one another. So that's what I would say. Is, it's a point where you just got to reach out. You gotta be able to call your sisters and brothers, and call your family. I know a family who said, you know what, we're gonna, since you telling us we gotta pay our rent, we all gonna move in here. We're gonna take these $10 that we got, and we're gonna split it among the 5 of us, and we're gonna eat, and we're gonna live, and then when this is over, we'll worry about where to go next.
That's right.
Yeah. Thank you for that.
And Ms. Mia, in regards to like community organizing, I think like a lot of times people are trying to figure out, how can I organize with my community? What would you tell those community organizers who notice there is something going wrong around COVID-19 testing, that my community is not being tested? Like, what is one way they can organize to make sure that they are, getting the help that they need,
Well, the first thing that is one of the hardest things is everybody coming together. There is so many organizations doing the same thing over and over, that nobody will come together and do the one good thing. And so that is, and it is really hard. Egos are in place. People are afraid you're going to take something from them. People are afraid that you may get 2 more almonds on your pecan pie than I get. So that is one thing that keeps us separate, but makes it so it's harder. And what makes it so bad about it is, that's what a lot of people know about us. They know that it is easy to separate us. It is easy to get us to think that the other people's water is colder. I'll say it that way. But it's easy for us. We are more fearful, and we are more concerned about what each of us is going to do or get, than coming together so that we can have one cause with a big voice. If we all had the big voice instead of 20 little voices, we could get so much more done. Because when you talking and you keep on talking, everyone knows the squeaky wheel gets the grease. And so we just won't be squeaky enough, because we want our own little grease. If they give me a dab of grease and give you a dab of grease, well, we all should come together and we all get degrees.
Hmm. And so I wanted to know, in your experience, because I dealt with this even not only in like going to hospitals to get treated, but just in general life, the whole angry black man, black woman thing, you know? And so like, how can we protect ourselves from that when actually I don't know how to phrase that question, but what are your thoughts on that?
I know exactly. You know what they call us, and I hate to say it this way. I told one boss, I said if I was a man, you would say that I was competitive. You would say that I was a
Assertive.
go-getter. You would say that I'm a
Yeah.
leader. But because I'm a female,
Mm-hmm.
because I'm a female dog.
Mm.
And so what happens is they feel like we're supposed to be in our place. And whether I talk with this soft, kind voice and I say, Mr. Man, could you please hear that what I'm saying is the truth? Or if I say, I don't understand why you don't understand me. It don't matter to them because it's the mouth that is coming out of. It's
Thank
not the
you.
way we're
Yes.
saying it, it's the
Yes.
mouth that is coming out of. So we
Absolutely.
are always going to be
Yep.
considered, no matter how we
Yep.
speak, how we reiterate anything, how we put our opinions on the table. We're always going to seem angry when we go against whatever the against is.
Yes.
Absolutely. And you know, it's interesting because I don't mean to get political, but my friend and I were talking about Barack Obama, and we were saying it wasn't necessarily the things that he was doing; it was more because of who he was.
Mm-hmm.
Yes,
Like him because of who he was. He was a black man
Absolutely.
in that position. You know,
yes.
that reminded me of what you just explained. Man, you know, Miss, do you have anything? I've been hearing the claps over there. Yes.
Well, Mia is really bringing courageous conversation up on this platform today.
Oh,
Yes.
come on now.
We hope that this is seen, more than just today, because it'll be live for a while. And, hopefully, like we said in the beginning, the people who, really make the changes in the city are able to see this and see what's going on in our communities. But no, there are a lot of questions coming in. I'll let you and Kimberly Joshua keep moving it
Okay.
on, but I'm loving it.
Okay.
I'm just so grateful for the conversation because we really need to have this sort of dialogue where we can just talk about it and ask some of these questions because
Mhm.
I am often seen as the angry black woman before I even open my mouth. I
Yeah.
guess it's just that look that I have. I was writing notes, but you were dropping so many bombs, right? I
Yes.
decided I need to just pay attention and yeah, like that. And I'll just watch the replay. So I thank you. I asked you in the beginning to come real and to come as yourself. And I love that you are speaking boldly and courageously because throughout this whole thing, right, you asked the main question, who are the leaders, right? And the thing is, a lot of the leaders can't say what they want to say. So I thank
Absolutely.
you for helping us to bring this dialogue and make it come to life about having bold and courageous conversations about how COVID actually affects us. I'm so glad you're here. Thank you.
Yeah. And I was gonna ask, Miss Mia, what can community do to support you in the work that you're doing?
Well,
Great
because
question.
we tend to rock the boat,
Okay.
as you can kind of tell. We do a lot of things, and one of the biggest things that when we open up the city is when we have things like when we go to City Hall, when we have communications, when we go to these meetings behind closed doors, we ask as many of us that can come. Um, be present. A lot of times, I don't even live in the community I represent, but I promise you, they think I do.
Right.
Because when they can't get there, if they don't have a ride, if they have to go to work, I can go and I can represent them.
That's
And
right.
I listen to what they say and I represent what they represent, what they want us to represent, not what I want my agenda to be. And when I hear that the agenda is going against and this is for everyone, when you're in these meetings and you hear that the agenda is going against what you know, what the people are feeling, say something.
Mhm.
Say something. I am one to raise my hand and say, that don't sound right. I don't agree with that. That doesn't make sense. That's one of my favorite phrases is that don't make no sense.
That's right. That's right. That's right.
And I
That's right.
need to make it make sense to me.
You know what? That's a beautiful way to say what you really want to say and kind of tone down the angry. You think I'm angry. I'm just not understanding what you're saying
Right.
at this time. Tell me more about that. Right?
Mhm.
I love
Mhm.
that. Thank you.
Yeah. And so, Ms. Mia, kind of talk a little bit about the work that you do with your organization.
Sure.
She does great work.
Right. All right.
Lay it on them, girl.
We do
Right.
a lot.
Great work that you do with your organization.
The funny part about our organization is we started out as a diabetes organization. We kicked it off by saying we're going to eradicate diabetes. Our pastor, he was diagnosed as pre-diabetic, and he came to a couple of us nurses and he was like, I don't want to be pre-diabetic. We come up with this program and we're going to teach everybody how to eat right, exercise, and take your medicine or not, or get off your medicine. But what ended up happening is we ended up being asked by the city of Austin to go out to the east side and see if we could just get in, because they're very closed off, and if you ain't coming correct, they will boo you out.
Come on now.
So they did that to us. We went out there and we were trying to get in and trying to love on them, and they're like, get out of here. They ran us out of a meeting. And what happened is we kept going and we kept going, and we would be at their school events. We'd be at their movies in the park. We would make sure that they saw us as their community members. So now when they see us, they say, oh, that's those C2H. And so what ended up happening is we won a it was called Call for Ideas with UT. And UT came in and said, you know what, y'all really ain't a diabetes organization. Y'all are really relationship brokers. Because what was happening was people would call and say, let me tell you what the city is doing to us. Let me tell you what's going on with us. Let me tell you what's happening. And we would make sure we was that bridge between the organization and the community. And we would tell the community, what do you want us to tell them? And we would tell the organization, no, don't say that. No, don't do that. So we still do our diabetes program, but we are more in the relationship brokering now. We are pretty much watchdogs for the community.
That's awesome. That's awesome. And so, Ms. Mia, one question I have for you is, I think for me, now that I'm getting a little older and when I go to get checkups, it feels good to see someone that looks like me is, talking to me about my health. So what are your views on, finding someone, someone Black to help you out?
Well, I try myself. I try and find an African American. When it comes to female, I try to find a female, because they know more about you. They'll listen to you more. Like I said, there's some good white doctors, some good, there's a lot of good doctors, but it seems that doctors that are that see you in them tend to treat you better. That's just, I think that's just natural. I think it's in whatever you do. If you think that if a doctor looks at you like his son, looks at you like his brother, he's going to treat you like that. The hard part about it is they stop our young doctors early, like in third grade. When they say they're bad, when they say that they have ADHD, when they say that they're not going to be anything, that's where they stop our colors from advancing, so that we have more African American doctors and we have more African American lawyers and more African Americans. They stop us early.
They sure do.
So we have to make sure that we're those mamas and daddies that don't let those teachers stop our kids early. my son was told, I was told that my son needed to be on Ritalin and that he was bad and that his mental capacity was small. When he in the fifth grade received his IQ was out of this world, but he also received a scholarship from the Q's in the fifth grade for academics. So if I had listened to that third grade teacher and put him on Ritalin, and he never would have graduated college. But I was that mama that they hated to see coming.
Yeah.
Oh, now.
So it's not that there's not Black doctors. It's just so few. And I think it's because they're in jail or we've stopped them on their course to becoming one.
That's a whole nother show right there.
Yes, it is. Yes,
it sure
That's
is.
a whole nother show right there. Wow.
This is good, Mia. This is good. Wow, and rich.
Absolutely. And I think it's so great that you believed that you did not believe what they were telling you.
Mm-hmm.
You trusted your view and your perspective. And now your son is doing amazing things. That's awesome. That's beautiful.
Yeah.
Awesome.
He graduated. I have both of my children graduated from college, but not for the lack of them trying to stop them.
Wow. Awesome. Really, did you want to go over some resources?
If you are done, then you can turn it back over to me. But I was just sitting here quietly because I wanted to allow Mia, the relationship broker, baby, to have
that one down too. Mia. That was good.
I wrote that one down. To have as much time as you needed. Ms. Mia, I want to give you an opportunity if you have any last words, anything important for us. Well, it's all important. Any other nuggets you want to drop for us?
My biggest thing is look out for each other. Don't let anybody just say anything and you be all right with it. Question people. Everybody's word isn't law just because of the color of the skin that their mouth is, the color their mouth is. We tend to think that because it comes from a certain person or a certain degree person, that it's law. Question. And then if you're not sure, a lot of times if I'm not sure about what I want to say or want to think, the Bible says there's wisdom in a multitude of counsel. Let's get together. Ask me, call me before you go into a meeting. Say, you know what, this meeting is about this. What do you think I should feel? What do you think I should say? What I hate more than anything is for us to be someplace and we're divided. And when I tell you it's something that they love to see, is to see us in some place divided. So when we're together, my mama used to say, I don't care what y'all do in here, but when y'all out there, y'all better take care of one another. And that's what I think is when we're together and we're places, we need to take care of one another. We need to stand up for each other. And then if we disagree, then let's come together then and say, girl, you know what? I didn't believe what you were saying. Explain that to me better.
That's right.
All right, Joshua, I would like to thank you for facilitating this conversation so beautifully.
Yeah,
we could not have done this without you. You were perfect for today's topic. It's just so beautiful. Thank you so much. So give yourself some kudos. Whoop, 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 whoop.
Hey, I'm just learning from all three of you. All three of you. I'm learning from all three of you.
When you're sitting in the house alone under quarantine, for me, I started having different conversations with myself in the mirror. Mm-hmm. The things that I told myself I could not do, I'm just going to keep trying them and just doing it, right? Yes. And so anyway, again, I am so grateful for the opportunity to be here with Saffron Trust. Joshua, thank you for being here. Miss Mia, thank you so much. Again, so many nuggets. I can't wait to go back and watch this. As we wrap up with reflection, what I took away from this is for people to remember as we talk about this overarching thing, COVID, and how it affects our people, is to remember that the doctor is not God, right?
Yes.
These are my notes. And I don't, Jesus is my boss, so I can say what I want to say.
Yes, you can.
Oh, come on now. Come on.
And then thing was, right now, more importantly than ever, my friends and my family, it is so important that you become an advocate for your total health. And because I'm a social psychologist, when we talk about health, please do not forget to take care of your mental health, right? All right. Just saying. All right. And then last but not least, I want to make sure you know that community care is where you can get information about testing. And also, if you need additional information about where the locations are on the east and the west, and you can go to the west if you live on the east, right? You can find that information at Austin Public Health. We thank each of you for your questions today. You can continue to add your questions into the feed, and long after today, we'll be able to answer your questions. Now, if you would like to get in touch with the relationship broker, I gave her a lot of titles, but she is the COO of C2H. Again, that is the Community Coalition for Health. It also is C2H. If you would like to get in touch with her, you can find her at www.c2h.us, right? All right. Also, Saffron Trust is here. We're not just here to talk or to put on makeup and to look cute from the waist up. We're here no, for real. We're here as real people to offer you real resources, right? And new discoveries and awareness. And so Saffron Trust is actually out in the community doing that. So since she won't do it, I'm going to toot the horn for her. Can I get a toot toot? Saffron Trust has given away over $55,000 in the last 3 weeks to families right here in Central Texas. So we're not just talking about it, we are about it. Now, when we first decided to put this platform together, when she came up with the idea from her orange couch, it was like, we're going to have some giveaway. I'm like, no. We're going to give away, but we want to respect you and who you are and your situations. So we'd like for you to be able to go fill out this simple form at saffrontrust.org /COVID/-19 and fill out a quick little form if you should need some resources. We are offering right now financial resources because I know that I'm one in that number. There's a church song for that, I'm sure. I'm one in that 33 million who is still waiting for some checks to come in or a new job, right? Also, last week we had Miss Darlene Turner with us, who is I now called the Black Doula. And if you would like information about that as we continue to face times of trying and tribulation during birthing during COVID, you can reach her at blackmamas.org.
And those links are being attached now on the Facebook Live, so they can see those links.
Absolutely. And if you notice, this is week number 3, so I'm trying to always run back through our guests that we always have, because what we're doing is we're setting up a toolbox for you so that you can have some resources. I didn't get all the information, but Rakima Pearsons as well is the play therapist who was on our very first show. And so remember, you can go back and you can find out all these resources. PBS Austin will offer at-home learning for pre-K through 12 from 6 a.m. to 5 p.m. Monday through Friday, and their website is www.pbslearningmedia.org. You know, as I practice this, I'm gonna get better at this. www. Right? All right. And then there's also Bright by Text. Bright by Text is a nationwide texting messaging service that helps parents and caregivers of children from prenatal to the age of 8 right now with different interactions, as we have to be creative on the inside. The mamas and daddies are the teachers. They are the counselors. We are praying, right? We got Bibles open around the house because since there's no insurance, nobody can get sick here. Again, my name is Lady Joy, Kimberly Holiday. I serve today as the Joy Facilitator. We'll be here again next week. I'm going to turn it over to the shepherd of this and the visionary of this whole thing, Miss Phyllis Everett. Again, thank you.
Well, this was a really good show. Mia, you were absolutely amazing. You really had courageous conversation. Joshua, thank you so much. Kimberly, thank you so much. The three of you together were just amazing. I just sat back and giggled the whole time. As you can see, my teeth were all over the screen. Mia brings it like nobody. I love the whole relationship broker. That one, Kimberly, that was a good one. That was a good one. The whole conversation was good. And so again, just thank you all. Thank the community and the leaders who will watch this and get all this good information. And with that being said, I'm going to turn it over to Kimberly. We're just about running out of time. We'll wrap it up. And thank you.
Again, thank you all for being here. We said we would be true to your time. This is the Power Hour. We're here every Thankful Thursday. So we'll see you back next week at the same time at 3 o'clock. Now, we're coming to you live from Austin, Texas, right? And we realize this is, you can view this globally. So I send you love, and I will see you all next week at the same time. Thank you so much.
Oh, next week. We are going to be featuring Angela Pye, author of A Black Mama Dying. She's going to be phenomenal. So she's going to be our guest speaker next week, Angela Pye. Yes, so join us.
You have an amazing lineup. And so I want to thank, I know that you've been strategic and very intentional in those that you have chosen. So again, Miss Mia Greer, we thank you for being here. And we'll hear from you again. And Joshua, we'll see you back again next week, same time. Y'all have a great afternoon.
Okay. Bye, everyone.
Later.
Bye.
Take care.